We continue to go straight to the infectious disease experts in Boston to understand coronavirus developments. So we're joined now by Dr. Daniel Koritskis with Brigham and Women's Hospital. Thank you. Good to see you again. In a couple of interviews now, Dr. Anthony Fauci has referred to COVID-19 as his worst nightmare. Those are his words. Do you share that opinion? And what exactly makes COVID scarier than diseases like Ebola or even the flu?
I think what's really unique about COVID-19 is just how incredibly rapidly it's spread throughout the globe. And because it is causing such a compilation of deaths at one time in each place where the virus has spread, that's overwhelming the healthcare systems. Now, we certainly saw that with Ebola in the countries where it was spreading, but fortunately, Ebola is not airborne. It had to be close contact, and so it was much easier to contain the spread, and effective measures were put into place that limited the spread. If Ebola were to spread globally like coronavirus had, it would be a terrible nightmare as well, to be sure.
So when we talk about that spread, maybe you can help us here. What's the difference between asymptomatic and pre-symptomatic spread? We're hearing both of those things. And with COVID, with coronavirus, which one's more dangerous?
Well, they're really very similar. The problem is we don't know, we can't predict the future, right? So pre-symptomatic spread is from somebody who doesn't have symptoms, but develops them in the next day or two. And they have a lot of virus in their oral cavity and in their nose, and they are very contagious. Asymptomatic is somebody who may have the virus, but is not going to develop symptoms. If we could tell those people apart, we might be able to say who is at greater risk of transmitting and who isn't, but nobody can really distinguish them, and it's hard to predict the future. The real issue is that people who don't have symptoms may be spreading the virus, whether they come to get symptoms later or not, and that's why it's so important that people be wearing a mask and continue with social distancing.
That's a good reminder. Let's talk about the city of Boston. They just opened a pop-up testing site in Roxbury today, so people can get a free test for coronavirus without an appointment or symptoms. Why is that type of clinic important, and what might you say to the public that would encourage them to go?
I think it's really important to have set up this testing site for several reasons. First of all, we know that people of color in the Boston community are at much greater risk, and having a testing site in Roxbury is really important to be able to reach out to the people at greatest risk. Secondly, we know that because people have been congregating as part of the demonstrations against racism and to protest the murder of George Floyd, that they may have been in situations where they were exposed, and making it as easy as possible to get tested is really going to help identify those who might be infected and asymptomatic, as we were talking about, who can then quarantine themselves and prevent spread to other people.
Okay, and preventing the spread there is still the goal. All right, Dr. Koritskis, thank you for your time. We appreciate it as always.
My pleasure.